Hello and welcome to Real Medicine with Dr. Canuso. I'm your host, Dr. Dana Canuso, and today we're going to talk about the latest topics in health and wellness. I'm very excited to introduce our guest today. He is one of my favorite types of doctors. He blends basically primary care and surgery and comes together to form a treatment plan that is right for the general person that comes in. So today I'd like to introduce Dr. Sunny Gupta. He's with the Rothman Institute, and he is a sports medicine primary care doctor. So
Yes.
Thanks for coming on the show.
Thank you for having me.
You're welcome. So I find you very interesting because you're not a primary doc, you're not an orthopedic surgeon, you're kind of a nice blend of the two. So
Yes.
Can you tell me a little bit about who you are and what kind of medicine you practice?
Absolutely. So what I do is really non-surgical orthopedics, which is basically musculoskeletal medicine that does not require surgery. So most injuries that take place actually do not require surgery. So I deal a lot with things like tendonitis, arthritis, non-surgical fractures, overuse chronic conditions, and with my specialty, I treat mostly extremities, so mostly like shoulders, elbows, hips, knee conditions. At my practice, we have other specialists that deal with the hand and foot and neck and back issues. But I basically handle the extremities and yeah, because most injuries don't need surgery, so this is where I come in. And of course, if we treat them or we deem that the patient needs surgery, then we refer them to a surgeon accordingly.
Exactly. And everybody, I think, knows who Rothman is. I mean, they're a really reputable and respectable practice in the South Jersey area and Philadelphia area. But tell me more about who you are, how you trained to get to this type of practice. Tell me about the
Absolutely.
background.
I always had an interest in musculoskeletal medicine since I was in college. So in college, where I went to school in Connecticut, I actually studied physical therapy, and that was my major. And I worked as a physical therapist for 2 years, and that was outpatient sports medicine. And but as I was working, I felt like I wanted to do more with my career, so I went into medicine. With the thought that I wanted to be an orthopedic surgeon because I used to work with orthopedic surgeons. So I actually started training to be an orthopedic surgeon for 3 years in residency. But during my time there, I realized I wasn't very happy. I wasn't enjoying it, and I wasn't sure if that's what I want to do for my career. So I switched out at that time when I had the opportunity, and I trained in family medicine. I completed residency there, and then I did a 1-year fellowship in primary care sports medicine. And that was done at Thomas Jefferson University, associated with Rothman, and then I stayed on at Rothman Institute for my job, and that's where I've been ever since.
How long have you been with Rothman?
It's been 7 years now. Yeah.
All happy times?
Very happy.
Spots?
Yeah. Really
Very
enjoy my
good.
time there. Yes.
Great. So I enjoy your type of medicine because most people that know me know that I think surgery is the last resort. It's very important for someone who needs surgical intervention, and some people it's not a question, you just need to do it. But I feel that sometimes we rush into surgery, and I think everybody deserves to go to someone like you first, see if there's anything we can do before we take the knife and cut you open and try to alleviate your pain. So tell me, most common for you. Do you have people with like knee pain that come in, or what's
Yes.
your most common patient?
I would say the two most common conditions I treat are knee arthritis and shoulder tendonitis. I would say that probably comprises anywhere from 60 to 80% of the patients I see,
Okay.
or the conditions I see rather. So, and these do not need to be treated surgically. Obviously, if they go through a host of treatments, they don't get better, then eventually surgery might be consideration. But off the bat, that's not something they need surgery for, unless, as you mentioned, that if they have arthritis and it's like, for example, very severe, and they tried other measures before, and then we think they need to see a surgeon, we'll get them to a surgeon sooner. But there's plenty of treatment options available to treat these conditions non-surgically, and hopefully have them avoid surgery, and that's the last resort. But if they need it, we'll get them to the surgeon. If not, then we hopefully get them better, and they don't need to come back to see us either.
That's nice.
Yeah.
I know. I used to say goodbye. I hope I never see you again.
Right,
Out of my
exactly, yeah.
patients. So your normal, 60-year-old active person starts having what is the initial problem that they start having with their knee that you would say, okay, you need to come in and see me. Let's evaluate this.
Sure. So it can be a number of things. It can simply be pain. Pain can be debilitating, and if it's bothersome enough, then they want to do something about it, then it's a good time to see us. Or if it's affecting quality of life. I tell them, sometimes people may have pain, but they can manage it. But if it's affecting what they want to do, let's say going up and down stairs is difficult, or they're having a hard time at their job, let's say they're a construction person or a laborer, or even if they have a desk job and they're sitting for a prolonged period of time and that hurts them. So it might be time to go see somebody for that. And there's plenty of treatment options that we have that can help them with that. A lot of folks in that age category tend to have arthritis. So we have many options, and I'll list them. You could try cortisone injection, physical therapy, viscosupplement injections, which are lubricant gel type injections.
Yeah, can you tell me a little bit more about the visco injections? I've heard about them. I don't know too much about them.
Yes. So what they are, they contain hyaluronic acid, and that is the molecule that your knee has naturally inside your joint, which is otherwise called synovial fluid. And that make the joint fluid naturally thick and slippery. But when you have arthritis, there's less of that molecule, so joint fluid becomes more thin and watery. So these injections basically replace that into the joint. So it creates more of a viscous environment, and it creates a more normal environment inside your knee that your knee's naturally supposed to have. So it lubricates the joint, maybe adds a little bit of cushioning into the joint. And we get great results with these injections.
So do you have a lot of patients that have failed maybe steroid injections that come to you for this injection therapy?
Exactly.
Okay.
Yes, they may have had steroid injections elsewhere, or we may have administered them ourselves, and they worked, and then wore off, and then many times this is another step, or the next step in the treatment to consider. We get great success, and average length of relief with these is about 6 months. So
is it one injection? Is it a series of 3?
It depends on the product. There's many products out of the market. Some, actually most are given as a series, but some of the product makers have actually, they provide a one injection option as well. And that's good for patients who either can't make it multiple times, or their copays might be high, insurance related reasons. So it's a matter of patient preference many times, but
Perfect.
we tend to do the series. We think it works a little bit better.
Oh, well, that's good.
Yeah.
But, all right, well, we're going to take a little break. I want to hear more about what you do when we come back. Don't go away. Hi, welcome back to Real Medicine with Dr. Canuso. I'm your host, Dr. Dana Canuso, and with me today is Dr. Sunny Guth, Gupta with the Rothman Institute. And we were just talking about your last name, and I can't believe I just screwed it up, but either way. So during the break, I learned something very interesting about you. You have a little experience with baseball, especially one of my favorite teams. So tell our viewers about that. That's exciting.
Yeah, I'm actually consulting with the Philadelphia Phillies through Rothman Institute. In my fellowship year, I was part of the medical staff. In our training, we had to work with the Phillies. We covered their Major League Baseball games. We did spring training physicals. And now I speak Spanish, so I actually go down to spring training every year and help out with the minor league physicals for all the Latin players in the organization. So they literally have a separate room for me for all the Latin players to do their physicals.
Wow.
So I go through them. We do a trip. It's about 2.5 days at the end of February, early March. And then I end up doing another overnight trip in April to do the Academy of Baseball players. These are players from Dominican Republic and Venezuela who they're developing to hopefully get to the major leagues one day. So I do their physicals for another trip.
Wow.
And this year I'll be helping to cover Major League Baseball games with the Rothman Institute team physicians as well too. So
that's exciting.
Yes, it
Well,
will.
and you're kind of the perfect person for that because you are the primary that deals with the orthopedic patient. So
yes,
obviously.
yeah. So we'll be handling most of the primary care issues. The orthopedic surgeon will handle the orthopedic needs, primary care issues. Players they're human beings, so they get colds, they get viruses and things like that. So that's where we help manage their primary care type symptoms and issues.
Do they come and see you off the field as well, or do you only do physicals for them?
So I do physicals for them. They end up seeing the official team doctors for those other issues. But I'm sure when I'm covering the games, when I'm in the training room, if they have any issues, then it'll be on me to help with their issues and communicate that with the rest of the team and staff.
So finally, when the weather breaks and spring starts, we can look for you on the baseball field.
Yeah, I don't know in the field necessarily, but we'll be downstairs up in the trenches, so to speak.
Where actually the work is being done.
Yes,
yeah,
exactly.
Good.
Yeah.
And then there will be Rothman docs at the Super Bowl this
Yes.
weekend, I hear.
Yes.
Ooh, I can't wait. I'm so excited.
Yes, yeah. So we hope they take good care of the players and bring home a championship.
Yeah, we can't take any more hits this season.
No. Exactly.
We're done with that.
Yes.
Very good. So we talked a little bit about when a patient should come and see you when they have acute pain, when they have pain that's affecting their quality of life. When do you refer them to surgery? I know it's a broad question, but what makes you say, we need to talk to a surgeon?
Yeah, so initially when the patient comes in, we look at their x-rays, we take their history, we find out have they had treatment before, what the injury was, et cetera. And if sometimes, they've been through, if it's a chronic condition, they've been through all the treatments before and they're not interested in pursuing that any further, we say, well, time to go see a surgeon. Alternatively, you may have, let's say, a 16-year-old baseball player who twists his knee, had tore a ligament in his knee, and non-surgical care is probably not going to benefit, so we refer them to a surgeon accordingly. So there's some cases that are clear-cut. However, others that are more chronic conditions that they've never been treated or they've only tried some measures on their own, that's when we say, listen, let's go through measures, because for example, arthritis may not be bad enough for surgery right off the bat, so that's when we start treating them. And then we hopefully go through them, and most patients do get better, and then if they have a flare, they'll come back again. But if it gets to a point, let's say we've been doing the treatments for some time, whether months or a couple of years, and now the treatments aren't as effective, or they're not lasting as long, or they're simply tired, like they say, listen, I don't want to go through this anymore, I just want to get it taken care of. And that's when we start thinking about surgery. But
okay. So it's individual.
Yes, absolutely.
Yeah.
Yes.
And the other thing, when you were talking, I was thinking, Rothman is nice in that there are so many specialties that you can internally refer to surgery. Do you ever refer to like a podiatrist for orthotics or anything like that if they have a certain knee issue or hip
Absolutely.
issue? Yeah, so
Yes.
it's kind of nice to have a comprehensive treatment plan with each patient because you have the benefit of all of these specialties in your practice. Well, that's exciting.
Yes.
So tell me more. I have to ask you, because you said you specialize really in knees and shoulders. I know a lot of people that have a shoulder injury and they kind of brush it off and it doesn't go away or it gets a little worse. Or when should you come in and say, it's been too long, I need to get this shoulder injury evaluated? Or does something like a rotator cuff tear, does that heal on its own? When do you come to you?
Yeah, and if it's affecting quality of life, I think it would be the main point I'd like to get across, because pain is subjective. Some people have a high tolerance of pain and they can manage with it, and if it doesn't affect what they have to do, then if they're able to live with it, then so be it. It's their choice. But if it's affecting quality of life, they're finding they're having a hard time doing things. One of the things we find with rotator cuff injuries is that they have a hard time sleeping, and it's positional. So that patients will say, I've had a hard time sleeping, I'm not getting enough rest, I'm groggy at work. So that's a good time to get it looked at. Or if they can't do basic things around the home, like comb their hair, reach the upper cupboard to grab a coffee mug, things like that. So it might be worthwhile to get your shoulder looked at, because there may be an injury and something we can actually help with and get them back to their full function again.
So is that something that kind of first line of treatment would be, let's try a steroid injection, or how do you treat rotator cuff injuries initially? Well, as long as you get an MRI and everything's copacetic.
Yes. Yeah, if it's not surgical, then cortisone is a great way to go. It's an injection, it's a steroid injection that is, it's a very strong anti-inflammatory. I tell patients that it's like putting the fire out. It helps you with your pain. It won't take care of the problem per se, but it'll help them with their pain. And then I usually recommend physical therapy to rehab their particular injury. So therapy works great to rehab a rotator cuff injury, provided again it's not surgical off the bat. But then you can also add medications. You can sometimes use topical medications as well, or activity modification. Simply don't do what hurts.
Right, exactly.
So different ways you can strategize to help get their symptoms better.
So I have to ask you, because I've always thought about this. So you recommend physical therapy. So in my mind, someone has an inflamed area of tissue, a ligament, tendon, something. How do you use physical therapy? In my mind, I want to rest it, right? You're telling me, no, go work on it. Are you working on basically like the adjacent tissues, or how does physical therapy work when you have an acute injury?
Right. So with physical therapy, they have modalities that you may not be able to have at home. So for example, ultrasound machines, electrical stimulation machines, antiaphoresis, they have specialized heat packs, cold packs, things like that can help decrease inflammation initially. Then the physical therapist can work on regaining range of motion. They can use soft tissue techniques like massage, myofascial release, strain counter strain. There's different techniques that they can use. And then once they get the range of motion back, then they can work on strengthening. Shoulder is a complex joint. A lot of the motion actually comes from the scapular muscles, which is a wing blade area. So many times strengthening that area can really restore better function for the actual shoulder joint itself. So that's where therapists are very good. And nowadays, therapists really look at the whole body in a way. They may find that the shoulder problems are actually coming more from a problem with their core, so they work on that. So they really are very good at looking at the whole body now and seeing what ailments in one area may be affecting the affected body part.
Interesting. All right, well, we're going to take a little break, and when we come back, we'll learn a little bit more about you and exciting things at Rothman. Thanks, and don't go away. Hello and welcome back to Real Medicine with Dr. Canuso. I'm here with Dr. Sunny Gupta from the Rothman Institute. He is a sports primary physician, and we've learned a lot about him. I want to hear a little bit more about where you're going now. What is your next focus when it comes to medicine and helping your patients?
As you might be able to tell, I have a very big interest in baseball. I was a big baseball fan growing up, so it's been nice to be involved with baseball on a professional level here to be able to, my career. But I've also been a big fan of tennis, and it's a sport that I played for many years. So that's an area of interest I have now that I'm going to focus in and delve into a little bit more, kind of get into more tennis medicine and hopefully start seeing athletes and then hopefully getting them better. But it's something I want to.
So is tennis elbow is like a real thing? That's what you're going to be.
Yeah, that's one of them. Tennis elbow is definitely a condition you do see in tennis players. It happens secondary to one-handed backhand, puts a lot of pressure on the outside of the elbow. But somehow it got named tennis elbow because it's common in tennis. But we actually see it more in non-tennis players because it's an overuse issue.
Right.
So people that do manual labor, typing, rotational twisting movements of their elbow. So it doesn't. So I'll tell patients, for example, you have tennis elbow. They're like, but I don't play tennis. I'm like, this is what we call it, But
well, funny you mentioned the typing at a computer. So what types of injuries do you see that are office-based injuries that someone should be on the lookout for? Maybe I don't, go to the gym and work out, but all of a sudden I have this pain. Where is it coming from? It may be coming from your computer in your office desk, right?
And believe it or not, we see a lot of shoulder, not injuries per se, but shoulder pain because a lot of it's postural. So, for example, they're leaning forward, everything's forward, and so it decreases space that the rotator cuff has to move. So they can develop what's called like an impingement syndrome, and that can be treated with physical therapy and maybe a cortisone injection.
So an impingement syndrome, like the neuromuscular sort of thing, where the nerve is actually pinched?
Exactly, a rotator cuff tendon is pinched because of the lack of space. It's more of a postural issue. So one of the things that physical therapy will address is to really stretch, bring their shoulders back, and maybe do some ergonomic measures, get a better seat. That keeps them upright, or maybe raise their seat height, or bring their computers down.
Right.
Just some adjustments in the workplace that can help with that as well. But of course, also with typing, you'll see a lot of carpal tunnel injuries too.
Right.
That's a compression of a nerve in your elbow. Your wrist, and can be treated non-surgically, but sometimes ends up having to go to surgery. But that's a common injury.
And it's too funny. I'm embarrassed to say this, but I even notice with my cell phone, my thumb.
Yes.
It's not carpal tunnel, but I think it's whatever. There are so many little things that we're doing, these overuse injuries, and basically overuse is just the same mechanism over and over, and you have these little tiny tears in a tendon or ligament. And we're seeing these more and more because our daily activities are basically we're factory workers. We're typing all day. We're texting all day.
Yes. So there was a condition before smartphones came out, when the BlackBerries were popular, BlackBerry thumb, because people were using their thumbs, and they actually developed tendonitis of their thumbs.
Yeah.
I don't think they didn't use that term anymore, but people are on their phones all the time, so yeah, I'm sure there'll be some
something
term that'll come out
some
soon.
Apple thumb.
Apple thumb, yeah, right. Yeah.
That's hysterical. Yeah, I think a good rule of thumb for any pain is think about, almost journal. When are you having that pain? When is it the worst? When does it feel better? And you may even be able to pinpoint, it happens when I'm at my desk, or and you can modify your behavior to improve the pain.
And it's very important when we meet a patient. I take an accurate history. I want to know what happened, when did it happen, was there an injury, was there a trauma, did they do anything about it? If you listen to the patient, you get a good sense of what it may have happened and when it may have started. And then you can kind of guide it in terms of an appropriate treatment plan.
Yeah, it's funny. I used to have patients all the time. They had to have an X-ray. They want imaging, all this, and I said, but you don't understand. From your history, I can pretty much tell you what your problem is. That's what we practice medicine for. We practice knowing what's going on underneath you without visualizing it.
Exactly.
So,
a professor of mine in medical school said, listen to your patient, they're telling you the diagnosis.
Isn't that amazing?
Yes.
It's so true. Well, that's fantastic. So if you want to tell our viewers, I'm sure I have a lot of people that are watching that have one or more of the issues we talked about, and they'd love to meet with you. So if you could just tell them how they can get in touch with you.
Sure. Best place to reach us at Rothman Institute is calling the 1-800 number, which is 800-321-9999. Or you can go on to rothmaninstitute.com website. There's a whole host of informational things you can read up about Rothman Institute, see a list of our physicians, and then if you want to make an appointment, you can just click on the links there as well.
Oh, that's fabulous. And of course, if you want to get in touch with me, you can go to www.drcanuso.com. You can reach me on Instagram, Twitter, LinkedIn, all that good stuff at Dr. Canuso. And if you have any questions for Dr. Gupta or me, you can leave a comment and we will get back to you. So, well, thank you so much for coming. This was fabulous and I learned a lot. And I hope you'll come back in the future.
Absolutely, will do. Thank you
All
for
right,
having me.
thank you so much. And thanks for watching. Have a great day.